What does a clinical psychologist in private practice get up to in an average day? Well, today I have got 2 client appointments and I'm seeing them both remotely. I've then got a telephone consultation with a potential client who's looking for a new psychologist. What do I do in my sessions? Well, I specialise in working with usually complex trauma or normal trauma and grief, usually. And I will use a mixture of compassion focused therapy, EMDR, kind of sometimes wanging in some CBT. It'll really be kind of a bespoke mix based on each individual, what they need, what their individual coping strategies and reserves are at that time. We do teach stabilization strategies, which is how to, how to ground yourself, how to cope when you have distressing or intrusive thoughts. So before we begin to plow into kind of anything which might be really evocative, we make sure that clients are going to be able to cope with that, whether it comes up in a session when I'm obviously able to do coaching, or whether it crops up when they are going about their normal day-to-day lives. I have then got time for a quick lunch break, and then I've got supervision with my supervisor, which is clinical supervision, where we look at kind of client progress, we look at any things I'm stuck with, we have a think about formulation, and we think about kind of treatment planning as well. I've also got to review a podcast edit and plan for a new podcast recording. What are you up to today? I would love to know. Do let me know in the comments and let me know if you've got any questions.